Good evening, everybody. I'm sorry I'm having to do this on video, but unfortunately I've taken it. Thanks, Alok, very much for the opportunity. So the question that we have in mind is, do we or don't we need mental hospitals? To my mind, it seems straight and clear, yes, we do. Now, there are three stances that I'd like to advocate. One is that of a human rights activist. If I were genuinely concerned about a person with a mental health issue roaming the streets of any city, then ideally I'd like that person to be rescued, to be taken care of, and then to be rehabilitated. Now, where is this going to be possible? It certainly is not possible on the streets. So from a client's perspective, I think regardless of the socioeconomic strata, regardless of the person of whether the person is homeless or in a family, especially in the case of a severe mental disorder, the person should have access to an institutionalized hospital facility. If we went to provide this for the person, then in my mind that would be a gross human rights violation. My second stance is that of a manager. Having run an organization like the Banyan, I've seen all sorts of people enter the doors of the Banyan. People who've been abused, people who've ended up pregnant on the streets and delivered kids, people who've broken their limbs and not been well enough to realize they've broken their limbs and ended up with maggots. Now, we talk of a caring society, but unfortunately it's the same society that's marginalized them, that's not looked at them. These people have continued to live on the streets and unfortunately have just died nameless, alone, hungry, starving and abused. For me, that is a gross human rights violation. While I've seen all of that, I've also seen that over the past 17 years, the 2,000 odd people whom we rescued at the Banyan, several of them, especially in those cases where we've been able to reach people in a timely manner, I've seen their lives turn around. I've seen them recover. I've seen medical treatment, counseling, social interventions play a key role in bringing them back on the road to recovery. So if that is possible, it would be criminal on our part to just turn our backs and say, well, it's a human rights violation to have them enter a mental hospital simply because it's considered to be a place of abuse, and just let them remain on the streets and die a lonely and sad death. So since I've seen this turnaround in the case of the Banyan itself and in the cases of various other organizations that I have partnered with, like Udavu or like Ashadeep or like Karuna Trust, I believe it's possible to run a mental hospital sort of setup in a humane, kind, compassionate and strategic way. My third stance is that of a caregiver. In a country like India, where more than 50%, according to the Tendulkar Commission, it's 44%, but I believe it's almost double that number that lives below the poverty line. That's less than $1. And even if you have to look at it as $2 a day, it's a measly income. So people really have to work not just to take care of the people who live in their family, but just work to survive, work to eat 3 meals. In an environment of that sort, if you were to burden the caregiver further with a person who's not manageable, a person whom we've heard of several situations, the person just wants to jump into the well or cut herself or hang herself or run into the railway track. We have lost several people in similar situations. The caregiver's trauma and burden is immense, and that is not something that we can dismiss. So if you're talking about quality of life and improvement of the whole unit as a whole, which is also indeed going to help the client, then unfortunately we need to focus on the burden of the caregiver as well, and we cannot just diminish the trauma that the caregiver experiences. So from her perspective, to have a safe environment where the person is treated is certainly a must. Also, if you were to look at it from an economic perspective, the number of days that the person stays away from work, the caregiver stays away from work, are certainly a cost that we need to take into account when we talk about mental health policy. Now, having said that, just a very brief stop at the history. I know that a lot is being discussed in the morning sessions, and we've spoken about the good and the bad of mental hospitals. The reason that it started off, maybe to tuck people away. We have heard of horrific stories of the genocide. We've heard of the armchair, straitjackets and a whole lot of other things. But we've also heard of compassionate responses. So what I'm trying to get at is that there's no clear good or bad. Surely the bad may be a lot more overwhelming than the good. But this is a complex area. It's a new discipline. Psychiatry is only about 200 years old. Mental hospitals are hardly about 100 years old. I mean, in a clinical sense. Clinical responses in our own country have been about 50 to 60 years old. So keeping all of this at the back of our minds, I think it's too new a discipline for us to trash it or to embrace it one way or the other in a complete or in a holistic sense. We've seen various experiments take place over the past couple of years. The one experiment that I'd like us to pause and think of for a moment is the whole concept of deinstitutionalization that took place in the United States when people spoke of human rights violations. At that point, the most number of crimes as a result of people being discharged indiscriminately from hospitals took place. All of a sudden there were people popping off the streets not knowing what to do. These were people who were then harmed, caregivers who had trusted the hospitals had lost faith. It led to a large number of homeless people who had mental health issues in the streets, led to a lot of violence, and then it led to a lot of these people being arrested and ending up in jails. So instead of deinstitutionalization, what ended up, like Mr. Mohan Isaac mentioned in his email, was transinstitutionalization. So this experiment clearly failed, which means we are in a situation where we say that deinstitutionalization has not worked. We've seen it not work. The hospital system that we have, or the history, or the baggage of the history that we've carried forward is not great. So what next? If you look at India today, there are 42 mental hospitals in India. Not all are bad. I've visited at least about 15 of the 42 hospitals, and I've interacted intensely with 2 of them. One in Chennai and the other in Ahmedabad. Now these are 2 different case studies. The one in Chennai we worked with for 4 years, and our approach was, alright, the hospital is proactive. They're interested in engaging with us. Of course, there was a great deal of push and pressure and lobbying with the government and all of that. But they got to a state where they welcomed us, and when we worked out of the hospital, and our focus was very clear that we have a clear helpline, a system in which society can respond. We rescue people with mental health issues, we admit them, we treat them, we work from within the hospital, and then we reintegrate them. We're trying to mainstream this, get this in the form of a GO, so the whole process of care, treatment, rescue, rehabilitation was sustainable in the long run and part of the administrative system, not really a Banyan-driven program. Now this happened, and it worked reasonably well for 4 years. But what happened over a period of time is, as we got more and more engaged in the activities of the hospital, we realized the sorts of problems that mental hospitals faced. And in this case, it was right from the basic to gross human rights violations. So we started off with the very basics of not having adequate water, the diet being miserable, 90 people after a sudden roundup being cooped up in a little room with the roof open during the period of monsoon, people not being able to access medical care, sudden deaths, wounds that went untreated, inadequate bathrooms. So all of this really built up over a period of time, and despite very many interactions and a fairly good management system, though maybe what it lacked really was autonomy. The whole system came crumbling down. And why did it come crumbling down? It came crumbling down because the warders were the main people who protested to our participation. And why did they protest? Because the extent of corruption had to come down. The reason that the Banyan was thrown out of this program was because the warders couldn't handle the fact that bribes were being stopped, that taming of patients was not being allowed, and various other, I don't want to get into the micro level problems that we face, but essentially the warders were the ones who protested the most. The management couldn't really put up a strong fight. There was lack of intent at that point at the government level, and finally the whole program came crumbling down and the media blew it up completely. So the government had to respond. There was a PIL filed, there was public pressure, civil society responded, and finally today, 2 years after we've been thrown out, water is not a problem, adequate number of toilets are there, staffing has been changed, there are 100 new staff who've been employed, right from healthcare workers onwards to social workers to medical professionals. There is a water purification system, the diet has been changed, beds have been allocated, new buildings have been created, so there's a lot that's happened. Now this is a case of reforms that has happened through public pressure and through the legal system. In the case of Ahmedabad, it worked in the reverse. So the government itself realized that there was a need to do something. So there was intent right from top. The bureaucracy stepped in. The leader was dynamic. The leader realized that there was a need to do a lot. And what did they do? They started off by reforming the very infrastructure. So the buildings looked a lot more humane. It wasn't the same 200-year culture that we took forward. The staffing was adequate. He welcomed 14 NGOs into his fold. So the whole system of reintegration, the whole system of transparency came in just by opening up the doors. So the place is a fairly happy place. I've seen various other hospitals. Goa, I know Sunito is going to be speaking about it. But the last